So now the question is, what exactly is a haploidentical transplant and when do we do it? So we have a patient who needs a bone marrow transplant. He does not have a 10 by 10 or 12 by 12 or 100% matched donor available. We searched in the international registry and we did not find a donor which is matching with our patient. So then the only option left is a haploidentical bone marrow transplant. Now what exactly it is? So when the baby is born, 50% HLA comes from the father, 50% comes from the mother. So that means the 50% is the minimal criteria a child is likely to have from either mother or father. And if we can transplant with a 50% matched donor, that means now the patient can get a transplant. In common words, we call it a haploidentical transplant. And good thing is, any child who needs a transplant can be given a transplant because either the mother or the father will be matching at least 50% with this patient. Now there are two types of haploidentical transplant. One is German technique, which is known as T-cell depletion transplant. The other one is post-transplant cyclophosphamide, which is known as T-cell replete haploidentical transplant. What is the difference? So the difference is, in the T-cell replete or post-transplant cyclophosphamide, it is almost equal to or slightly costlier than the 100% matched transplant. In this, we collect the cells from the donor, we give it to the patient, and then we wait for 3 days. Now it is important to realize that even if you are a 10 by 10 or 12 by 12 matched donor transplant, these cells react. But if you are just 50% match, they will react more. So how do you settle these cells is the whole art of haploidentical bone marrow transplant. In post-transplant cyclophosphamide, after giving the donor cells, we wait for 72 hours and then we use a drug with the name cyclophosphamide on day 3 and day 4 that kills all the troublemaking cells. This is a good transplant, very properly, very commonly done transplant, and just some extra cost than the matched sibling transplant. But the more sophisticated transplant in the haploidentical transplant is the T-cell depletion transplant. What does that mean? So I told you that even if we are completely matched, our T cells create a lot of problem once we put them inside the patient's body. If you are 50% matched, they will create more problem. So how do we get rid of them? There is a mechanism in the T-cell depletion technique. We use a machine that actually kills, or we actually separate the cells which are likely to create problem after the transplant, and we do it before we actually give the cells. So that means we collect the donor bag, and from the donor bag we remove the T cells, and then once we remove those T cells, we give it back. We call it T-cell depletion haploidentical bone marrow transplant, or in more scientific term, we call it TCR alpha, beta and CD19 depletion haploidentical transplant. And the result of these transplants are even equal to matched sibling donor transplant. So I hope now you understand that these are the two different types of transplant, and this will help you taking your final decision which one is better and which one is required for your child.